My name is Amol Nergudkar. I'm the CEO of Patient Prism, and here with Teresa Duncan, we're talking all things insurance. And Teresa has been in the industry for over 2 decades. She's been recognized as one of the top 25 women in dentistry, and gives talks all over the country at all the conferences. She's one of the speakers talking about dental insurance. Yeah. She does a podcast, says Nobody Told Me That. It's a great podcast. I encourage you guys to listen to it and subscribe. She's also an author of an amazing book, which I recently read, called Moving Your Patients to a Yes. And it talks about easy insurance conversations.
Yes.
So this segment really is about conversations and billing. And how do you, we know how it is at a dental office, right? The patient's ready to get out.
Yes.
As soon as they're done. They don't want to be in the dental office. And now you have to have a conversation with them. It's a little complex. And it's a billing conversation. And you have to be calm, because I know you've got a lot, as an insurance coordinator or a person at the front checking out, you've got a lot going on. And in the midst of that, you have to stay calm. And you have to kind of divulge some news that may not be most optimal to the patient in terms of what it costs.
Yeah.
So how do you kind of maintain your composure at the front and have this conversation, a calming conversation with your patient that, hey, this is what it's all about?
So there are witnesses everywhere. So you have to make sure, of course, even if no one is in the waiting room when you're talking to them about it, somebody could walk in. So you always have to make sure that it is a calm area. It helps if you're a calm person.
Okay.
That's actually something that people don't think about. When you hire someone to speak to your patients, they have to have a good attitude about it. You can't have somebody that's not very confident. And
Sure.
And let's just say this is my baseline. When I was consulting, I would always say no surprises. Sure. No surprises. So when a patient is coming up to pay their bill, they should be completely aware of what their responsibilities are. So when we're presenting our treatment plan and telling them how much it's going to be,
Sure.
a lot of the common pushback is, well, I didn't think it was going to be like that, or I thought my insurance covered everything 100%.
Sure.
So let's talk about how they kind of elevate. You start to see them get upset, you start to see their blood pressure rise, and that's where we have to take our cues from staying calm. So I always say, let's keep a steady voice. If their voice starts to elevate, let's bring it back down, even lower our voice a little bit more.
Sure.
So it's just just some techniques. So you don't want to mirror them. We always say with
Sure.
communication you should mirror them, but
Right.
this is the one time where you don't want to mirror
Right.
them. So we kind of bring them down, kind of slow down the conversation a little bit. And then we acknowledge that we understand it was a surprise. I'm so sorry. I know this is a surprise to you, and we don't like surprises at all. So let's talk about how we can handle this. So we're going to acknowledge it. I don't want you to necessarily apologize for it, because
Sure.
it's their benefits, right?
Correct.
So then just move on to the next point, which is, well, let's talk about this. Let's talk about how much can you afford per month? Are you open to using third-party financing? So then you move into your treatment plans. But say you have somebody come up to the front and they're just angry.
Right.
I mean, they're raging, right?
Right.
You have to move them away. You can't have them out there. So make sure you have an open operatory or an open consultation room and just get them out of there.
But how important it is, and we talk about this a lot, of you yourself being educated about why they need the treatment, right? At the end of the day, because that's how you sometimes can calm them, right? I mean, hey, this is what you need. Let's say you need a bridge, and if you wait, and this is what's going to happen.
Yeah.
I mean, you kind of want to give them that, you want to be their advocate, right?
Right. So we use a lot of, in my experience, what I have seen, what I have found. So if somebody doesn't want to have that bridge, and we know they need the bridge, I'll say, we have found that when people get their teeth extracted and they don't replace it, then they end up having more issues down the road.
Sure.
And if you have examples there, that's great. But if somebody's pushing back about the cost, it's not really the treatment they're pushing back on. It's the convenience of being able to pay, or even being able to pay. So you have to address that. And how do you make it easier? How do you make it correct? That's something that I think a lot of offices have happen that goes against them, is that their co-payment estimations are not always accurate.
Oh, absolutely.
And then they get pushback, and then you have patients that don't trust you. So I think we have to get better at that as an industry.
Well, inherently, I mean, it's challenging enough, right? Especially you're out of network, you have no idea what the fee schedule is, because you don't know how to obtain it, and it's shot in the dark.
Yeah.
And so being, but I guess getting back to that calmness, right? I mean, do you offer some training in terms of having those conversations about How do you deal with these difficult situations?
Yeah, I mean, I can definitely help an office with that. Basically, it is all about crisis management. I hate to say it, but that's really, I learned a lot of that from studying crisis management.
Okay.
Because when somebody's elevated and coming at you, your first thing is you have to calm them down. Right. And a lot of times it's really not distracting them from the problem, but putting them in a different mindset. And that's why moving to a different room has a big impact, believe it or not. Just that walking down to the operatory changes a little bit of the dynamic, and then being able to sit across from them like this changes a little bit of the dynamic. When I was at the front desk for years, somebody would be standing up here and looking down at me and arguing with me, and if I stood up or maybe took them into a different room, it's just a different tone. So I think your front office team or whomever is going over financing has to have training in how do you handle upset patients.
And how do you recommend personality testing when you're hiring somebody?
I do, yeah. I used to not, actually.
Okay.
I was one of those that was like, oh, just hire for ability and all. Now I realize there's definitely good clinical people types, clinician types, and there's good administrative types.
Sure.
And then there's some that are able to straddle both, but you don't want somebody who's introverted to have these financial conversations. I mean, I've watched people literally shrink, when somebody's coming at them, and that's the time when you stand firm.
And we've seen in our industry, in our experience, some of the best insurance coordinators have been people who've never done any clinical stuff, but they're just good at calming a patient down. They're calm themselves, and it kind of helps reduce anxiety. These are great. I mean, definitely communication. Again, it all comes back to that. Right?
Always.
You've got to be able to get a patient to trust you, and you getting irritated at the patient or at the plan that the patient may have that you may not like, and oh my God, they're you have the wrong plan.
Yeah.
Or you cannot do that.
Oh, I hear that all the time.
You've got the wrong plan.
But it comes with confidence too. I think the person that's having these conversations has to be confident in their job and be confident in their communication skills. And unfortunately, I don't see that as often as I'd like.
So do you recommend communications training? Absolutely.
Yes, absolutely.
And there's lots of resources out there.
Oh, yes, and you know what? The very most simplest resource is to do role play in your office. Offices don't do a lot of role play, and because they hate it, it's uncomfortable, right?
Right, absolutely.
But it's working.
Well, these are great suggestions, and we'll continue the conversation about this. But great segment on dealing with difficult billing conversations, being calm and calming the patient down. Thank you so much.
Oh, you're welcome. Thank you.